Hello, I'm Dr. Michael Thompson and welcome to Solutions. Now, you're probably wondering, wow, this is really strange. I'm watching this video, but we use a lot of videos and technology in our office for two really. We really don't know where people are coming from, and what their experience has been with chiropractic. And we found that using videos really helps educate our patients, which then helps get the best results possible if they know a little bit more about how their body functions and works. Secondly, we use technology to we run our office really smoothly, which makes sure that we stay on time for our patients and their appointments. There's no waiting, and also really helps us be efficient and keep our costs down, so it makes it comfortable for everybody. Now, before we get started today, I just wanted you to understand that first and foremost, our job is going to be to find out if I'm even the correct doctor for you. Now, luckily, it's pretty easy. If your problems are being caused by some sort of spinal misalignment, I can more than likely help. If we find out that it's not a spinal misalignment causing your problems, well, then my job becomes, all right, well, let's find out what's going on and let's get you to the right doctor in the community so you can get the help you need. Okay. Now, we want to make sure that you understand exactly what we're looking for today. And what we are going to be searching for is what we call vertebral subluxation. Basically what that is that's when you get misalignment in your vertebrae and it starts to cause abnormal nerve system function. Okay, we have to determine today if your pain is being caused by a simple muscle or ligament problem, or if it's gotten to the point that it's starting to affect those nerves. And the reason that that's important is because of this here. If we look here, everybody knows your brain controls everything in the body, right? I mean, that's how God created us. So your brain's job is to send messages down the spinal cord, and those messages go out all these nerves to control all the organs of your body. So for your heart to beat, for your lungs to breathe, for your intestines to digest food properly, these messages from the brain along these nerves have to travel back and forth at 100% level. I always tell my patients, listen, if you were to cut this nerve going to your heart, what happens to your heart? It stops. Okay, if you cut it to this nerve going to your lungs, you're not breathing anymore. We all inherently learned this at a very young age. Now, when people get a spinal misalignment, okay, imagine if these two bones right here in this person's spine are compressing on this nerve, and this nerve happens to go to their heart, and now only 50% of these messages are getting to the heart. How well is it going to function? It's not going to function at 100%, and you'll start to get abnormal function of that organ and set up disease processes. Okay, now here's the interesting thing. If I was to take this nerve and cut it, it's like a computer wire. This is a cross section of a nerve. So you cut that computer wire, and we look inside here. What's inside that computer wire? A bunch of little wires. Okay, and that's what all of these are. They're called neurofibrils. Well, only 4% of the nerves in your body, only 4% of them send pain messages up to your brain. So research shows we have to get up to 40% compression at that nerve root level, which means up to 40% loss of function to whatever organ that's going to before we trigger enough pain fibers that we feel the pain. Okay, so we have to determine, is this a simple muscle or ligament problem if things are just stuck like that, or is this vertebral subluxation and it's starting to compress nerves, which then causes abnormal function of other areas of the body. Okay, so what we're going to be doing today is, in just a little bit, either myself or our patient health and event coordinator, they'll be coming over. They'll give you a quick little office tour. I'll kind of show you where the restroom is and where everything is in the office, make you comfortable. And then we're going to be doing some orthopedic tests and do some orthopedic examinations. These are just manual tests where we're seeing if you have maybe complications that can be caused by misalignment, like disc bulges or disc herniations and things of that nature. After that, we'll be doing what's called this nerve scan. Basically, this just runs up both sides of your spine, and it's just measuring skin temperature from one side to the other. Well, the skin temperature is controlled by how much blood is flowing through all those little arteries. And what controls that is your brain sends a message down the spinal cord. It goes out those nerves and tells those arteries to open or close depending on the weather outside. It should tell both sides of your body the same thing. So if you see a big difference in skin temperature from one side to the other, that means some of these arteries are really open and some of them are really closed. indirectly, that means that's not normal nerve function, that we're starting to get some nerve involvement. So when you look at those, when we get done with that nerve scan, if we find anything that has these deep purples or reds, that's abnormal function, or these darker blues, that's abnormal nerve function. If you get into yellows, this turquoise, orange, green, that's normal variation from side to side. Okay. If we are suspecting that there's vertebral subluxation causing compression of nerves, well, then we'll want to take x-rays immediately, because we'll have to find out exactly which bone that is misaligned, which direction does it go, how misaligned is it? Is it a little bit, or is it, if it should be here, is it a little bit, or is it all the way here? That dictates what needs to be done to fix this. Most importantly, what we'll find from that is that depending on what level, what nerves is that affecting, and how could that be affecting not only your pain now, but your health now and into the future. So I'm glad I had an opportunity to explain to you what we'll be doing today, and welcome to the clinic, and we'll see you soon.